Why dentistry is a good question. I really liked, again, the dentist that I had growing up. I liked the type of person that he was, the things that he was able to do. And then I had a friend as well in high school whose father was a dentist, and, you know, like the way that they live. I think in the U.S. especially, that we don't realize how incredibly blessed we are from a medical standpoint. That, you know, sometimes it's hard to get to and sometimes it's expensive, but we have access to care. We can get to a dentist if we need to. In these places, they really can't. You know, they're a 3-hour bus ride from the nearest dentist, and when they get there, it's significantly outside their price range. For me, mentorship is very, very important. And if you've got somebody that's been there, you know, that knows kind of how to get your legs underneath you, especially in those first few years, that can be valuable. Just kind of setting you up for success for the rest of your career.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, an Endeavor Business Media production. This is episode number 385. My name is Andrew, and thank you so much for joining me today on the show. And by the way, new grads, congrats. Happy graduation to you all. Our guest today is Dr. Ben Hulbert, and he is the brother of the infamous Daniel Hulbert. Just brings a smile to my mouth when it sounded weird. Well, we're going to leave it in the episode anyways, but it brings a smile to my face, I think is what I meant to say. Because you may remember Daniel, who he's one of my best friends. He's non-dental, but he's been doing dental adjacent things with us for all of these years, since the very beginning of the podcast. I think dating back to early 2016, I think. He also came across the good old US of A with me when I moved from Washington State down to Florida. Anyways, we have his younger brother, Dr. Ben Hulbert, who has been practicing for a few years, and he's dabbled in a couple different environments, which is why I want to talk to him today. He did a little bit of work in DSOs and then private practice. He worked in an office where, you know, he was the only doctor, but then, you know, an office that had multiple doctors. He's seen so much. I just want to talk to him about his experiences working in rural settings and just being a new grad, all of the different things that make him unique. How is he handling inter-office communication? I thought that one was going to be that question, just as like a spoilers for people. I thought that question was going to be hard for him to handle, but unfortunately, or maybe it's fortunate, you know, he and Daniel are both extremely laid back individuals. And so, I don't know. It made me feel like I think all of us would probably want to work with him because he's just so laid back. So I'm excited for you to listen to that one today. And then next week we have Dr. Kim Cooch, which, oh my gosh, I can't believe it's been this many years without him being on the podcast, but he's going to make his way to the show. We talk a little bit about cardiology, things that he's learned in his education with patients and educating other healthcare professionals about prevention. He is another one of those doctors who just absolutely loves the hygiene team. So I know you're going to love that episode. Be sure to hit that subscribe button on your podcast app. And if you have a moment, it's been a bit, if you guys will please just go over, leave a rating and a review, I would be very appreciative. Okay, one little thing before we get to the episode. I was flipping through some of my old notes from last year. It's this pile of notes that I have of what am I going to say for that show? How am I going to open the show, or what are we going to talk about? And I noticed that a lot of them were themed of, oh my gosh, we're growing. We have this big, you know, audience. So it's so amazing, all this excitement. And all of a sudden one day I stopped, and I just kind of stopped informing you all of, you know, the progress that we're making as a show. And I'm not really sure why that happened. I don't know if it's just because like when we were acquired, I just kind of felt maybe I shouldn't talk about that anymore, or I don't know. So I wanted to tell you, I mean, I guess a brief update on the show and the progress. I think I mentioned a couple weeks back that we had our 2 millionth download, and that was huge. But another big change that we had that came probably around mid to late last year, we used to have in the early days, 2020, maybe 2021, we'd have about 800 downloads per day. And now we are more than doubling that. We're around 2,000 downloads per day. And it's pretty incredible. I mean, I don't know how else to like continue to like be as amazed and in awe of all of you listening to the show. It's pretty phenomenal. I think my favorite part about it, though, is that we get to have new people introduced to us and inviting them on the show. And I think I'm referring specifically this last month, we had Ellen Myers. We had a listener that had reached out and said, hey, I think this would be a great guest. You should get her on the show. This is what she could talk about. And we reached out and we made it happen. And it wouldn't be possible without all of you. So I'm very, very thankful for all of the help that you all put in for not only just listening, but being a part of the show. If you do have another idea or suggestion of topics, or even new segments or anything that you are thinking about that would improve this for everybody, send me an email, andrew@atale2hygienist.com, so I can follow up. I can follow up with if it's a new guest or if it's a new topic, I can source new guests, whatever it takes. I am truly thankful for all of you for listening. I hope you continue to enjoy the show. And with that, please welcome in Dr. Ben Hulbert.
A tale of two hygienists.
Welcome everyone into the interview portion of the podcast. I'm so excited. I am here with Dr. Ben Hulbert. That last name for you listeners, if you listen to the intro of it, it might sound a little bit familiar. And I think actually, yes, Dr. Ben, by the way, it's hard to call you Dr. Ben. All the doctors I know, if I'm just oh, it's Ben, it's Ben. But hey, Ben, welcome to the show.
No, thanks for having me. Happy to be here.
Oh my gosh. This is okay. So I have a lot of questions for you planned. One of the biggest issues I find in dentistry is communication between, hygienists and doctors and assistants, hygienist assistants, front office. The communication aspect is very weird. And I think a lot of it has to do with kind of where we're coming from, the demographics that we're treating, kind of where, the educational levels and all the different things that happen that make a really cool office. And I want to dive into that a little bit later with you today, but I want to start off with just the journey. Who is Dr. Ben Hulbert? Where did you come from? Why dentistry?
Sure. No, that's a great question. So I graduated in 2020. That would have been around April, kind of the height of the COVID pandemic. So that was an interesting time. Directly following school, I got a job in Boise, Idaho. And so we're still here in the area, but that job didn't work out. I think COVID kind of shifted their expectations with the patient flow and exactly how many patients they were going to be seeing and the need for I would have been the second associate. So it didn't pan out there. So then I ended up working at a different practice in Ontario, Oregon, just over the border, and worked there for about a year. And then ended up having an opportunity to return to my hometown and work with the dentist that I had growing up. So it's kind of a full circle, kind of a fun moment there. So yeah, so that's where I'm at. I've been there for just over a year. So relatively new grad. I've been practicing for just over 3 years, and it's lots of fun. Why dentistry is a good question. I really liked, again, the dentist that I had growing up. I liked the type of person that he was, the things that he was able to do. And then I had a friend as well in high school whose father was a dentist, and, I like the way that they live. So it was, a couple different things. And then, in undergrad, kind of getting into the science courses and learning the why, and felt like I was being drawn to healthcare. And then that was kind of a moment where I realized that I wanted to be in healthcare, and in that particular aspect of dentistry was just a really organic fit. So that's kind of how I ended up where I am.
All right. So I got lots of questions now about just those few statements. Okay. COVID, a COVID graduate. So this was your senior year. March is when it hit, and then you only had a few more months, I guess, until you graduated. So did that really impact very much as far as, getting a license, taking your board exams or anything like that?
Board exams, not necessarily. We were kind of done and dusted by then. My clinical boards and I guess also the oral and practical portions were all done the year prior. So I actually did my clinical boards in October. And so that was all basically done and dusted. And then licensing was, the paperwork was kind of a backlog, but I didn't really notice anything there. One major bummer was we didn't have a graduation because they just, no one really knew what was going on. It was the height of all the chaos. And so they just canceled it, which was kind of a bummer. Not necessarily that I needed, to walk and to have all the pomp and circumstance, but I felt like, I don't know. I think my family would have appreciated the opportunity to be there. I mean, they supported me through 4 years of undergrad and 4 years of dental school. So yeah, that would have been cool to have been able to do that. And yeah, that just didn't happen. So it was interesting. So we were moving from Utah, where I did my undergrad or did my dental school at Roseman University. to Idaho on the day of my graduation, and we stopped at a Taco Bell parking lot, and my wife sang the Pomp and Circumstance. So that was my dental school graduation, which was delicious. I mean,
I'm sure. I mean, it's better than some Zoom graduation or whatever yeah. No, I love it. Okay. So that was your senior year. Let's say the juniors or maybe even third years or second years that you might have even known. What have you heard about like their experiences going through and finishing up some of their educational requirements?
well, my experience was I was one of the final classes that did the traditional licensing boards versus now I think they do the integrated board. So I had the part 1, part 2, and all of that. I think now I'm not terribly familiar with it. I think it's one exam, and they have more options as far as with the patient portions that they can do more on the mannequins. I was lucky that I didn't love working on the mannequins. I feel like I appreciate more working with patients.
Yes.
And so I feel like for me that worked out better. And having chatted with some of the undergrad friends that I have, that were in previous years than me, they seemed to do fine with it. I think it was a shift, and that just need a little extra practice. But yeah, sure, a little different.
So when I moved down to Florida a few years back, and I was licensed in Washington and Oregon, and then I moved down to Florida, and I had to take a whole new exam, and it was on the mannequin exam, or it was on a mannequin. I tell you what, it was completely different than what I expected. And this was 2020. Well, I think it's 2021 actually when I took the board, just because it was like that first generation though of these mannequins for the exam. And I don't know, like you just imagine. I mean, just like the difference of like the feel of plastic versus tooth structure, like is completely different. Well, for us, it's scaling and root planing, right? So you're over here with these like brand new curettes, and I'm just like cutting into this plastic, and I'm like, there was probably calculus there anyways. It's fine. And so it was just a weird experience. And since then they've gotten a lot better, I know, but I'm with all those, everyone else. Like it's an adjustment. Okay. Actually, that leads me to another question. So you're licensed then in Idaho. That's where you initially started practicing. To get licensed in Oregon, was it very hard at all? I mean, portability is all the rage discussion right now.
Sure. No. And the benefit that I had was that I'm being a relatively recent grad. I think there's a grace period of somewhere between like a couple of years. So I didn't have to retake any of the exams, and I took the CDCA licensing exam. So that qualified me for most states to be able to apply. I think there's a couple, maybe New York, but I could, in theory, could have a license in Jamaica. So that would be kind of cool. But
cool.
Oregon luckily was one of the states that did accept the CDCA as a licensing exam. So I was able just to apply straight across. I don't have that license is no longer active. I don't anticipate working in Oregon anytime in the near future. But yeah.
Well, it sounds like you're pretty set where you are. I mean, hopefully.
Yeah. No, it's been a really good shift, and my team is awesome. So I have no complaints.
How does it work when you're potentially seeing, and I think with your community, you probably know a lot of the patients already, but how does that feel about like, they saw me grow up, they saw me throw rocks at that car that one time, and now I'm over here like their healthcare professional? Like, how has that shift been?
I thought it was going to be more odd than it was. And there is some of that, right? Where like, some of these, especially these older people that I grew up with, that I, knew their families, and they did see me do the silly youth things. But it's less odd now, I think. And I had about, a 15 year or so spread where I wasn't really around. So I grew up in this small town, and then, I went to college, went on a mission for our church, and then, dental school. So it was about 15 years. And so I think there's been some time where, memories have faded, and, sure. Yeah. So it's been less weird than I thought it was going to be. I thought there were going to be more growing pains, and there's still people who are like, "Hey, Ben," I'm like, "Hey, man, how's it going?" So I kind of take it in stride. It's not a big issue for me.
So knowing your family like I do, you brothers are some exceptionally high performers. You think about the career paths you've all have taken. I just got to know, like, I tried to talk to Daniel about this, and Daniel, he doesn't exactly all of his feelings very well, but what is the drive there? Like, there's got to be something that has come into your lives that said, "Hey, look, all of you, go be these great things."
Sure. It's an interesting question, and I don't know if I have a good answer for it, but yeah, I think to my parents' credit, what they did is they encouraged us to get work at an early age. And, that's not always feasible, but in Idaho, you can start working, very early. And a lot of people, working on family farms and things are working, as young children, but you can get an actual job at age 14. And so I think most of us did. And we worked jobs that probably weren't that much fun. Some of my brothers worked for, beehive places that were very rough. I worked in several different fields. We all worked for farmers around us. And it's, it's hard work. And I think that instills in you getting work and then realizing early that, that's something that you're going to have to do. And you also kind of decide what your likes are, what your dislikes are. Mm-hmm. And kind of know where you want to be. But I think that establishing early of the grit and also the work ethic certainly helps. Mm-hmm. But yeah, I don't know what the formula is other than it seemed to have worked, but
it really has. Going back to your dental school experience. Yeah. I talked a lot to the doctors that come through, the podcast, and it's always baffling to me to learn, I think, that, what you all learn and what you all do in dental school is sometimes you'll have an assistant helping you out and sometimes you won't, but almost rarely, never will you ever have a hygienist. And so what was like the educational process and or the exposure to dental hygiene other than the whole do it yourself, you do all the scaling and root planing part of it?
Sure. No, and Roseman has a little bit of a different teaching model. So they do, I guess, as far as the curriculum, it's all pass fail. So there's a certain standard that if you meet that, then you pass, right? So it's not like a traditional grading system like in some other schools. And then in the clinical aspect, we worked a lot with our underclassmen. And so, getting up there, you're just holding suction, you're doing slurping lots of spit, which is great. Good exposure. And then hygiene, we did all the hygiene, and we did have our clinic. We had about 100 chairs, but the clinic was divided into 4 different sections, and each section had a hygienist kind of overseeing that. And so what they would do is basically when you're finished up with the cleaning and with the patient, they would come and do kind of a final check and just make sure that you're, removing the calculus, debriding what you need to, and getting things clean enough that it, meets their standard. And that it worked out pretty slick. There was kind of a backlog on occasion just because, you had 7 people all finishing an SRP about the same time. Mm-hmm. And so you'd kind of have to wait just to have that, have them come. But and that was more so when you're just kind of getting started. Once they realize, that what your skill level is and your thoroughness and things, and they kind of were a little bit more expeditious. But yeah, that was the basic premise, is that you would do the cleanings and you would finalize with the hygienist.
That's pretty incredible. I like that a lot. Has the transition then into practice been different than you thought working with a hygienist? Has that communication, the handoff, the reporting of the patient's case, has any of that been a little bit of a surprise to you?
Not really. No, I think that my schooling prepared me fairly well, and I was able to do a lot of cleanings in school. I think I did just over 150 SRPs and prophies, paramedics. So I did a lot, and I got to know my hygienist very well. She was a super nice gal. And we chatted, not just about dentistry, but just in general, because I'm kind of a chatty Cathy. But I have the benefit right now that my hygiene team is fantastic. They're all very skilled. They're all very well spoken and put patient care first and foremost. So that's, I think we all have the same goals. And so that makes it very, very organic, just that kind of that discussion with the patients or with and to the patients. Mm-hmm. Yeah.
Now, in the conversations that you have with your dental buddies, have you learned anything that's unique about like maybe rural dentistry versus, big city dentistry, or things that you just didn't anticipate, or things that you really appreciate about working where you're at compared to working in a big city?
Yeah, no, I have several friends who are actually in the military doing their commitment payback. And that's been interesting to see kind of their experience. And then I have some other friends who are doing corporate dental. I did corporate dentistry for about a year, and that was unique as well. And so, yeah, it's been cool to kind of see where the similarities and also the differences. I think depending on military seems like a very good option for a lot of people, but sometimes may limit your exposure to certain treatments and, patient base. Cause, typically if you're treating soldiers, right, your patient base is going to be within X amount of years, and you may not see a lot of children or a lot of,
probably decently healthy though too, right? I mean, because you have so much demands on home hygiene and all that kind of stuff. For sure.
So I think there's some differences there. And then I had a buddy who was doing kind of a community health. And that was, I think tricky for him just because, the patient populations, depending on where you're at, can be very, very different and can be very challenging depending on, need and history with dentistry, and just general dentistry knowledge can be lacking in some of those areas as well.
But you've also done some mission work down in Guatemala, right? So
yeah,
you've been exposed a little bit to more community health. What are your thoughts about that kind of dentistry?
It's very needed. I've been able to do a couple different trips. I've been to Guatemala twice, and we do about a 10-day mission trip down there, which is just the coolest experience. We go and because of the remoteness and just the lack of care, what we do is just purely extractions and hygiene instructions. We bring a lot of toothbrushes and a lot of forceps. And it's just a really cool experience because there's such a need. And I was also able to do about a 10-day trip as well to the island of Samoa, which was very cool. I did dentistry in a lava, so that's not something everybody gets to do. But it was, it was very cool. And these mission trips are very rewarding from both a personal and a clinical aspect.
I think a lot of listeners, I have probably been on mission trips before, but just in case they haven't, specifically Guatemala, I've done several of them down in Guatemala as well, and I love them. You're right. I mean, everything you said is right on point. But can you walk them through, like, maybe what does a clinic typically look like, or what can it look like, and then what does like the intake process look like? How do we have those communications with patients and things like that?
Sure. Yeah. So the owner doctor at the practice that I'm at actually served his mission for the Church of Jesus Christ Latter-day Saints there about 30 years ago. So he had some contacts in that neck of the woods already, which was nice. So we've over the years, they've done this trip for about 10 years now, but over the years they've gotten really close to one of the, I want to say mayor, but I don't think that's the right word, kind of the leader of one of the areas down there. And he sets up typically 3 to 4 days of either dentistry and plus service. And so a typical day, what we'll do is we'll go to one of these remote areas. And like I say, what we do is we set up in kind of a base camp in this town that we go to. It's called Panajachel. And then from there, we'll take a bus, 2 to 3 hours kind of in any direction, and find these small little villages. And then we will set up we've set up in anything you can think of. We set up in schools. We've set up in just kind of these open palapa style areas. We've set up in medical clinics, and we have wooden chairs that recline slightly. They're basically just, functionally like a beach chair that's made out of wood. And so it's not terribly comfortable, but we put them, and what we realized last time we went is that we put them kind of in a semicircle. We can almost do like just bounce around chair to chair. So we typically have a couple of hygienists that go with us, and they help with anesthesia. And then this past time we had 4 doctors. And so between the 6 of us, we were able to, bounce around, get everybody numb. And as far as the patient intake, typically we just set up a whole bunch of lawn chairs, and we'll show up to these places, and there's about 100 plus patients waiting from all ages. And then at that point, we'll have a doctor out there just kind of, chatting with them, finding out symptoms, and also just triaging, saying, okay, this tooth hurts. And we'll look in the mouth and say, yeah, that one probably good to go. And then they get a little piece of paper just so we can kind of keep track of names and numbers. And then they're going to the treatment room and get all the teeth pulled that they need. So it's a crazy different kind of experience. But yeah, this last time we treated just over 400 patients, pulled something like 400 plus teeth. I don't really remember. Yeah.
Wow.
But it's
great.
Busy. It's busy over the course of about 3 days. Yeah.
That's incredible.
Yeah.
I mean, obviously you sound like you have a really good experience with all of that. I mean, do you feel like mission trips like that are for everybody, or does it take a very specific type of person, do you think?
I certainly think that everybody could benefit from doing something like that, just because we don't know, I think in the US especially, that we don't realize how incredibly blessed we are from a medical standpoint. That, sometimes it's hard to get to and sometimes it's expensive, but we have access to care. We can get to a dentist if we need to. In these places, they really can't. They're a 3-hour bus ride from the nearest dentist, and when they get there, it's significantly outside their price range. So I think everybody could certainly benefit from it, but the downside is sometimes the accommodations are less than we're used to here. In Guatemala specifically, you're not allowed to flush your toilet paper. It's because it will clog up the rudimentary plumbing systems, and so the restrooms can be a little bit spooky sometimes. Just the not necessarily up to our level of cleanliness that we expect here in the U.S. But yeah, no, I think certainly everybody could benefit from just that idea of paying it forward and paying it back a little bit.
Yeah, no, for sure. I think it's one of those things that has helped me fight burnout in dentistry multiple times. I'm like, okay, I have this trip coming up to, the DR or Guatemala or whatever. And then when I come back, I'm like re-energized, revitalized, like ready to, face the world again. It's been awesome. Okay. So let's go back to that not patient communication, the office communication.
Sure.
Because I've been very lucky in my career. I've worked with a lot of new grads, and, you get all types of different people. You just do. I mean, that's just the makeup of human beings.
Sure.
So what I want to ask, I mean, not to out you with your office, but like, was it a pretty smooth transition? I mean, you'd already been practicing, so you weren't like right out of school.
Yeah.
But maybe talk about one of your other offices, if that's like, what was your experience like as a brand new doctor, and how could we have made it better as a team?
Sure. No, and I think, yeah, my apologies to my previous offices that had to see me kind of grow into a dentist, but it's tricky. I mean, when you think of a dental clinics, right, in dental school, you're seeing one, maybe two patients in the morning, one, maybe two patients in the afternoon. So you may have a day where you see one or two patients.
Mm-hmm.
And then you go to the private practice model, and you're seeing, probably 4 or 5 patients in the morning, 4 or 5 patients in the afternoon, plus hygiene checks. And so it's just a much more rigorous pace, as far as treatment and seeing patients and getting things done. Where, if you're used to that dental school model, you've got an hour and a half to 3 hours to do a filling. And so you don't really have that sense of urgency built in.
Right.
But I think, and this is probably me just speaking from not having saw myself as a young dentist, but I feel like the transition went fairly smooth. It was obviously a learning curve. They would probably say different. They're like, whoa, this guy is slow, but it wasn't, it felt more natural. And I think depending on the person, it can be a little bit more. And I pride myself. I think I handle stress fairly well, and even so, yeah, there probably were times where I just failed drastically and didn't even realize, just because of, my nature of being novice in the game. But yeah, I think the transitions went fairly well. The difficult part for me in my early years of being a grad was actually when I was working for a corporate dental office in Ontario, just because I was kind of starting this practice from the ground up, and I don't think I had the expertise or the experience needed to really do that. So I think that was tricky. I think it was more than I planned and bargained for, but you can't, I mean, it's in the past, right? So there's nothing really I can do about it now, but.
Well, let's dive into that just a little bit if we can. So when you say that you don't have, the expertise, my imagination goes into like, well, probably dentally, you're probably pretty sound, like how to refer out and all that kind of stuff. But was it more like the business, like the management of staff and teams and
Certainly
overhead and all of that kind of stuff?
No, yeah. When I say lack of experience, I feel like dentally, I was able to expose myself to a lot in dental school. And even with these mission trips, I feel very confident and comfortable with a lot of different procedures. Mm-hmm. But, now we're I'm put into this position where we're talking management of personnel. We're talking marketing. We're talking, kind of a grassroots marketing campaign where I need to kind of get people in the door. And I didn't know how to do any of that. And so that was overwhelming. Luckily, with these corporate models, they do provide a lot of support in theory. But yeah, I think from a patient management aspect, that was fine, but it was just hard, dealing with inter-office relationships and conflicts and things where that's not really my forte or cup of tea. And so that was difficult. Yeah, that was hard to manage.
Now, we're not picking on this particular office, but hypothetically, in all of the offices, what are some of the pain points that you are seeing? Like when you've been in management roles or leadership roles, what are the pain points that dental offices have as far as like communication goes?
I feel like that's a good. It seems like the front and the back is always kind of a pinch point. It's a matter of feet as far as distance, but just the difference in, they're worried about a certain aspect of dentistry. We're worried about a different aspect of dentistry, and those don't always coincide. So I feel like that's a frustration. We have in my current office, we use a headphone radio system, and that certainly helps. But sometimes, we're elbows deep in a procedure and they're trying to talk to us, or they're trying to check out 3 different people at the same time and we're trying to talk to them. And so that can be a source of frustration, I think. And I feel like at each of our quarterly meetings, that's always brought up. It's like, we need to be doing better with the radios or whatever. So, but I feel like that's, just not that what they're trying to do is wrong, but we're focusing on different aspects of dentistry. And so there's going to be friction, I think.
I mean, you're right. We all have an expectation of like, we need to get these things done now, fast. We're on a schedule. We only have this allotted time. Like we live and die by our schedule, and the front does as well, right? Like they are trying to get these patients in and out, checked in, checked out. And then also they have to deal with insurance companies, all sorts of other things. I think that you bring a great point that I think if we understood each other's role a little bit more, I think that we'd be, getting cross-trained, having I think a hygienist having to make a call to an insurance company would open our eyes to things that you would not even believe. It'd be so annoying. What are your thoughts on this? I've been a very big proponent over the years in the podcast. I come from a corporate world. I started in private practice, moved into corporate. I love corporate just because I love systems and things like that. Unfortunately, fortunate for me, but unfortunate for the situation. Like I've always, like, my corporate was awesome. It was like the best one. Like you're never going to find that. It's like, the golden goose. But would you recommend that people start in corporate? Because I always say that hygienists, at least 1 year, go to corporate, get your speed, feel all those, you see a different aspect of dentistry at corporate level sometimes.
Sure. No. And I think that's an interesting question, because recommend, I guess I wouldn't necessarily dissuade people from doing. I don't know if my experience wasn't, I don't think, the best. Just because, like I said, it was just me and dentistry, I think, is a lonely profession in the best of times. And this wasn't the best of times. So I kind of felt, I was in a kind of off by myself. It was about an hour drive one way to get there. And so it wasn't an ideal situation, but I think corporate certainly has its place. And certainly for a new doctor, because for me, mentorship is very, very important. And if you've got somebody that's been there, that knows kind of how to get your legs underneath you, especially in those first few years, that can be invaluable, just kind of setting you up for success for the rest of your career. So I guess I don't know if I would necessarily recommend it, but I don't know if I would actively dissuade people from doing it either. Just, feel it out, make sure that, you're reviewing your contracts. And certainly that would be something to consider as far as options of employment, for sure.
Yeah. Nice. That's a good balanced answer. I like that. You could run for politics on that one. Okay.
Please no.
All right. So again, we're not picking on any particular office that you've ever worked at. I want to be very clear about that, because you're going to go into the office and like your hygienist will be like, what did you say about us? Yeah, no, I think, just big picture messaging for the hygiene community. When we want to work with our doctors, like, what are some things that we need to be conscious of or think about to make sure that we are communicating effectively and properly, with the caveat, of course, that every doctor is a little bit different, blah, 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 all those little qualifiers. But big picture, like, what could we do better?
That's a great question. And I don't know if I've got a good answer for it. Like I said, my team right now is fantastic. Issues that I've seen in other offices and just chatting with my friends and things, it seems like sometimes we all want the same thing, I think, as dentists and hygienists. Like there's differences of, maybe personality and opinions, but at the end of the day, we want our patients to respond well to care and to get the adequate care that they need. And I think sometimes dentists can, I don't want to say put themselves on a pedestal, but kind of be like, oh, it's just hygiene. But I mean, hygiene is very important. It's the basis, it's the foundation, kind of keeping things. You can have the most beautiful restorations, but if your bone is just rotting away, it's not gonna stick around. So I think sometimes, and I think like what you said boils down to communication. If we can just realize that we're all on the same team at the end of the day, right? We all care about patients. We all care about their oral health, or at least we should, right? And if that's and if we don't, then that's a different conversation that needs to happen. But I think we all come from that same aspect of, we all want what's best for the patient. We may have different ideas of how to get that. How do we put those two ideas together? I think that makes for the most organic and least potential for, friction and error there.
I'm going to flip it on you a little bit. Now start talking to your dentist. And there's not that many dentists that probably listen to the show, but start talking to your dentist friends. Like what is something that dentists need to do better? And I mean, I know you kind of answered a little bit on that one, but like what do dentists need to do better to help foster, a safe place for communication or more clear communication?
Yeah, that's and in actually in dental school, I was dealing with with a situation where this crown had been placed that just had the bulkiest margin. It was just the worst looking crown, and we see stuff from time to time like that. But I think as dentists, we shouldn't be surprised when we create uncleansable situations and periodontal disease is the result. I don't think that should be like, oh, what happened? Like I think if we do good dentistry, we can set our hygienists up for success. And that includes, making sure that our margins are adequate, making sure that, we're not just sacrificing soft tissue just because, right? So I think working again in tandem and just knowing that what we do can really set them up for success. And so just being extra cognizant and careful with that to make that a reality.
Good answer. Do you have any last messages?
No, not necessarily. Just happy to be here. And yeah, dentistry is a weird job. It takes a weird type of person to do it, but it's a fun job as well. So we all, I think, enjoy it in different aspects. And yeah, it's a good field to be in.
Dr. Ben Hulbert, thank you so much for being on. I really appreciate this.
No, thank you, sir. Appreciate you having me.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.